In 30 years of nursing, I've sat with men who waited too long. Some of them knew something was off for months, and some of them for even for years. And almost every one of them said the same thing when it was too late to change the outcome. I just thought it was going to go away. Today, we're going to talk about why that happens. Not to shame anyone. I've never met a man who waited because he didn't care. Far from it. They waited because of something deeper than that. And understanding it might be the most important thing you hear this week. But before we get into today's topic, if straight answers about men's health are useful to you, please subscribe. That's what this channel is. Anyway, we got a question this week that came in from a man who identified himself as a 48-year-old man by the name of Tony. He works in northern Alberta on heavy equipment, and he wrote, I've been getting a fluttering in my chest on and off for about 6 weeks. It's not painful, and it only lasts for about a few seconds. I looked it up online and scared myself half to death. Then I decided it was probably nothing and stopped thinking about it. It feels like this was the wrong way to deal with it, but it scares me. So it's best left in the closet. I think, anyway. Hmm. Well, thank you for the question, Tony. And I want to answer this carefully as I think he's asking a deeper question. So, what you just described is two things happening at once, and both of them matter. So, let's go with the first thing. The first is the symptom, a fluttering sensation in the chest that lasts a few seconds and resolves on its own, is often a palpitation. The heart briefly beats out of its usual rhythm and then it returns. In many cases, particularly in otherwise healthy men, isolated palpitations are benign. They can be triggered by whether it's caffeine or dehydration, maybe there's stress or fatigue, or simply nothing identifiable at all. However, 6 weeks is the part that becomes not nothing any further. And on and off means it's a pattern. What I'd like to know is, does it happen at rest or during exertion? Does it come with anything like dizziness or any other chest tightness or shortness of breath? Has it changed in its frequency or its intensity? These details change or can change the picture significantly. Here's the honest answer to your question. No, deciding it was probably nothing is not the right call because uncertainty is not resolution. Also, 6 weeks of a repeated symptom is your body asking for clarification, not panic, clarification. That distinction matters. Tony, I urge you, please go get it checked. Not because you should be afraid, because, well, you deserve to know. Thanks again for the question. And Tony, good luck with the follow up. Please let me know what happens. And thanks to everyone for asking your questions. Keep them coming. Let's talk about avoidance. Here's something I've observed across 30 years of nursing, and I want you to hear this not as an opinion, but as a pattern I've watched repeat itself in ward after ward, patient after patient. Let me say this clearly. Men are not careless about their health, they're conditioned. And by conditioned, I mean they're conditioned to endure, they're conditioned to outlast, and they're conditioned to downplay. And that conditioning works, and it works well until it doesn't. The question worth asking is why? So it starts with how men are raised. From early on, most men receive a very clear message, spoken or unspoken. It's push through, don't complain, and handle it. That message has value in certain contexts. Resilience matters and endurance matters. But applied to the body, it becomes dangerous because the body doesn't respond well to being overruled, doesn't like it in the least. Symptoms are not complaints, they are communication. And ignoring communication doesn't make the message go away, it just delays the response. The identity factor is for many men, especially men who define themselves by what they can do, by what they can carry, and by what they can endure. Acknowledging a symptom feels like an admission that something is wrong, that they are less capable perhaps, or maybe even vulnerable. My, wouldn't want that now. So the symptoms get reframed into, oh, it's just stress, or it's because I'm getting older, or everyone feels like this. The famous one is, oh, it'll pass. Sometimes it does pass, but sometimes that reframe buys time for something that didn't need more time. I've watched that reframe cost men everything. The fear factor. Here's the other side of it. Some men don't avoid because they don't care, they avoid because they're afraid of what they might find out. And that fear is understandable. A diagnosis can feel like a door closing, an identity shifting, or maybe just life changing. But here's what 30 years has taught me about that fear. What you find out early is almost always more manageable than what you find out late. Avoidance doesn't protect you from difficult news, it just changes when you receive it. And by then, the options may be fewer. What it actually costs. I've stood in a room with a man's family and explained why we couldn't do more. He'd had chest discomfort for 6 months, called it heartburn. By the time he came in, it was a massive heart attack, and we were already behind. I've seen fatigue dismissed as getting older, that turned out to be severe sleep apnea and uncontrolled blood pressure. I've seen men who avoid a 5-minute appointment and paid for it with a 5-day hospital stay. That's not drama, that's pattern recognition. The data on this is consistent. Men are diagnosed later. Men present to emergency rooms at more advanced stages of illness. Men also die younger from conditions that were detectable and treatable earlier. That is not fate, that is a pattern. And patterns can be interrupted. So the real talk here is avoidance may feel like control, but information is control. In 30 years, I have never, not once, regretted a patient coming in too early. I have regretted the opposite many, many times. I'm asking you to consider that paying attention is not weakness, that noticing something and acting on it is not complaining, that the men who take care of themselves are not soft. Strength isn't pushing through everything. Strength is knowing what deserves your attention and giving it. So, what to do differently? Starting now, when something shows up, a symptom, a change, something that doesn't feel right, don't immediately reframe it. Just note it. If you have to, write it down. When did it start? How often does it happen? What makes it better? Or maybe what even makes it worse? That's not obsessing about it. That's just gathering information, right? If something persists and if something repeats itself, even if it escalates, or if something simply doesn't sit just right, that's enough. You don't need a dramatic symptom to justify a conversation. You just need a pattern. Not because something is definitely wrong, because you deserve to know either way. Listen, the information contained in this video does not provide personal medical advice, diagnosis, or treatment, and should not replace a consultation with a qualified healthcare provider. That's all the time we have for today. But here's what I want you to carry with you. Your body doesn't negotiate, it signals. The earlier you respond, the more options you have. That's the difference. The question is, are you willing to listen? I'd like to thank you for being here, and I'd also like to thank you for trusting me with your time.